Most men have no idea that HIV can silently attack the prostate. Studies show that men living with HIV are 3 times more likely to develop chronic prostatitis, but 9 out of 10 never connect the dots. A few months ago, I met a 22-year-old man who came to the ER at 3 a.m. with unbearable pelvic pain. He'd seen 3 doctors, tried 5 antibiotics, and still had no answers. One more test, the one most doctors never think about, changed everything. I'm Dr. Jame, and over 2 decades of treating men's health, I've seen this pattern again and again. Pain that keeps coming back because the real cause is hiding in plain sight. In the next few minutes, you'll learn why this happens, how to recognize it early, and what every man should do before it's too late. Before I tell you what that missing link was, ask yourself this. Could your chronic prostatitis be connected to something no one has ever warned you about? Before I guide you to the solution, I want you to understand this first. What was actually happening inside the body of that 22-year-old man we met in the ER? His story isn't rare. Many young men face the same pain, the same confusion, and the same silence around a condition called prostatitis, a deep inflammation of the small gland sitting just below the bladder, responsible for producing part of the fluid that makes semen. In men under 50, it's one of the most common reasons for pelvic pain, yet one of the most misunderstood. Doctors divide it into 4 main types. Type 1, acute bacterial prostatitis, a sudden infection with fever, chills, and painful urination. Type 2, chronic bacterial prostatitis, infections that keep returning with short relief after antibiotics. Type 3, chronic prostatitis or chronic pelvic pain syndrome, CPPS, long-lasting pain for more than 3 months without clear bacteria. It includes inflammatory, IIIA, and non-inflammatory, IIB forms. Type IV, asymptomatic inflammatory prostatitis, inflammation found on tests even when you feel fine. Typical symptoms include burning or pain while urinating, difficulty starting the stream, frequent urges, especially at night, pressure in the pelvis, groin, or lower back, and sometimes discomfort after sex or ejaculation. Our 22-year-old had nearly all of these. He'd taken antibiotic after antibiotic, only for the pain to return stronger each time. That's the moment when a good doctor pauses and asks, "What if this isn't just infection?" In the next part, we'll uncover how to tell the difference and which tests reveal the truth that changed his story forever. Don't stop here. I want you to understand something deeper, how this connects to the so-called disease of the century. When you understand how HIV interacts with your immune system, you'll finally see why the prostate becomes such an easy target. Remember our 22-year-old? When his blood tests came back, one number caught my eye. His CD4 count was lower than expected for someone his age. That's the quiet fingerprint HIV leaves behind. HIV doesn't kill you directly. It weakens your body's defense army. It infects and destroys CD4 helper T cells, the very commanders that coordinate your immune response. As these cells fall, the body loses control over bacteria, fungi, and viruses that normally stay harmless. Once CD4 cells drop, infections no longer need an invitation. Even ordinary bacteria from the urinary tract can creep upward into the prostate and trigger inflammation that refuses to heal. That's why men with HIV have a 3-fold higher risk of chronic prostatitis. Their immune system can't clear the infection fully, so the bacteria linger, forming microscopic colonies that flare up again and again. In our patient's case, every round of antibiotics gave short relief because the root problem wasn't the drug. It was his weakened defense. His body was fighting with half an army. Here's the truth most men never hear. A healthy prostate depends on a healthy immune system. And when HIV starts eroding that line of defense, inflammation spreads beyond one organ. It becomes a full-body issue. In the next section, I'll show you how to identify this pattern early and the one lifestyle routine that can help your immune system fight back, starting today. Listen carefully to this next part. In just 1 minute, you'll gain a level of understanding that many men spend years missing and suffering because of it. Our 22-year-old patient returned a week later, still exhausted, still in pain. What puzzled him most was how his symptoms didn't seem to fit neatly into any box. Fever one day, muscle aches the next, fatigue that wouldn't fade, and those unpredictable urinary problems. He told me, "Doctor, it feels like I'm fighting something inside, but no one can name it." That confusion isn't his fault. The early symptoms of HIV and prostatitis can overlap so closely that even trained doctors sometimes chase the wrong trail. Let's look at them side by side. Fever and low-grade temperature. Both conditions can cause mild fever. In prostatitis, it's the prostate releasing inflammatory signals. In HIV, it's the immune system reacting to a virus that just entered the bloodstream. The result? The same warm forehead, the same fatigue, but completely different meanings underneath. Fatigue and muscle pain. Prostatitis can drain you because of chronic inflammation. HIV goes deeper. It attacks CD4 cells, weakening energy production and immune coordination. That's why men often say, "I feel like I have the flu for weeks." Our 22-year-old said the same, and that's the red flag. Urination problems, burning, difficulty starting the stream, or frequent trips at night. Classic signs of prostatitis. But HIV indirectly amplifies these symptoms. When immunity drops, bacteria colonize the urinary tract more easily, irritating the prostate again and again. The man blames his bladder. The truth hides in his blood. Why, it's easy to confuse the two. Because both conditions trigger inflammation. The body speaks a single language of pain, fever, ache, fatigue, pressure. Most men, and even many doctors, treat the noise but miss the source. They prescribe antibiotics when the real issue is viral. They rest for fatigue without checking why the body is crashing. Our 22-year-old's chart told the story perfectly. Every antibiotic cycle gave him a short break, but the fevers and body pain returned stronger. When we finally tested for HIV, everything aligned. The chronic immune stress was feeding the prostate inflammation. Here's the bigger lesson. Prostatitis may be the first visible symptom of an invisible immune war. Men under 30 rarely expect it, but HIV doesn't check your age. It looks for opportunity. That's why awareness matters. Recognizing the similarity isn't meant to cause fear. It's meant to short-circuit delay. The sooner you test, the faster you act, the better your recovery. In the next part, we'll break down the exact tests and biomarkers that reveal whether it's infection, inflammation, or immune imbalance, and how our 22-year-old finally got his life back. Listen closely. If you, or someone you love, recognize a few of these signs, speak up now. You might pull someone back from the edge. Here's how to tell HIV-related illness from prostatitis without guessing, using our 22-year-old as a living example. HIV, rash, weight loss, swollen lymph nodes. Rash, often flat or slightly raised, non-itchy, starting on the trunk and spreading to arms, cheeks, face. It typically appears 2 to 4 weeks after exposure and lasts about a week. Lymph nodes, tender, rubbery swellings in the neck, armpits, or groin that persist. Weight loss, unintentional loss over weeks to months, sometimes with night sweats and fever. System feel, I have the flu that won't quit. fatigue dominates more than localized pain. Prostatitis, pelvic pain, urinary problems, nighttime trips. Pelvic perineal pain, pressure or ache between the scrotum and anus, pain after ejaculation, low back or inner thigh discomfort. Urinary issues, burning, urgency, weak or stop-and-start flow, nocturia, waking to urinate. Pattern: acute bacterial cases hit suddenly with fever and chills. Chronic CPPS lasts 3 months, flaring with sitting, stress, cycling, or cold. System feel: localized, nagging, position-sensitive pain more than whole-body sickness. Why they're confused so often? Both conditions inflame the body, so early signals, low-grade fever, body aches, fatigue, sound identical. That's why antibiotics may give short relief when the real driver is immune dysfunction. Timing clues you can use today. HIV, acute retroviral syndrome. Symptoms start 2-4 weeks after risky contact. The 4th-gen Ag-Ab test usually turns positive by 18 to 45 days, and an HIV-1 RNA test can detect infection 10 days after exposure. Prostatitis. Acute infection escalates within hours to days after a urinary prostate insult. Chronic forms grind on for 3 months with good-bad days. If symptoms began soon after a new partner, or you notice mouth ulcers or a generalized rash with fever, raise HIV higher on the list. If pain spikes after long sitting or cycling, prostatitis climbs. Back to our 22-year-old, his pelvic pain and burning suggested prostatitis, but the tender groin nodes, 2 unexplained fevers, and a faint trunk rash didn't fit the usual playbook. Multiple antibiotic wins faded fast. When we broadened testing, urinalysis and culture, STI panel, prostate exam, 4th-gen HIV test with reflex RNA, the pattern finally made sense, and his care plan changed from repeat antibiotics to targeted treatment and immune support. What to do if this sounds like you? If pelvic pain keeps returning plus swollen nodes, rash, or unintended weight loss, ask for a 4th-gen HIV test and RNA if exposure was recent. If urinary pain dominates with position-triggered pelvic ache, pursue a prostatitis workup. Urine culture, STI testing, post-ejaculate or post-massage urine, and tailored therapy, not endless antibiotics. Whichever path you're on, don't delay. The earlier you name the cause, the faster you recover. In the next section, I'll show you the exact tests and 1 daily routine that helped our 22-year-old turn the corner, and how you can use the same roadmap starting today. Now is the moment I have to be crystal clear. When I finish this part, I want you to act immediately. Here's the bottom line for our 22-year-old. When to get an HIV test. Today, if you've had a new partner, unprotected sex, especially anal, shared needles, or a partner with unknown or positive status. Today, if you've had symptoms that look like the flu that won't quit, fever, rash, sore throat, swollen lymph nodes, night sweats, or unexplained weight loss. Today, if pelvic pain and prostatitis keep returning despite antibiotics. That pattern deserves an HIV screen. Timing matters. Get a baseline test now. If the exposure was recent, a 4th-generation Ag-Ab test becomes reliable by about 3 to 6 weeks. An HIV-1 RNA test can detect earlier. If you were exposed within 72 hours, ask about PP. If you test negative but risk continues, start a conversation about PrEP and retest on schedule. When to see a prostate specialist book. A urology visit if you have pelvic or perineal pain lasting more than 6 weeks. Burning urination, frequent night urination, painful ejaculation, blood in urine or semen, fevers with urinary symptoms, or if antibiotics keep giving only brief relief. Bring a simple log of pain, urination frequency, triggers like long sitting or cycling, and any sexual health exposures. Ask for targeted testing, urinalysis and culture, STI panel, post-ejaculate or post-massage urine, and a focused prostate exam. Avoid endless antibiotics without culture proof or a clear flare plan. How to talk to your doctor. Use one sentence that gets attention. Pelvic pain keeps returning despite antibiotics. I also have fatigue and tender nodes. Can we rule out HIV with a 4th-gen test and RNA if recent? Ask what the plan is if tests are negative. Pelvic floor dysfunction, neuropathic pain, or inflammation can all mimic infection and deserve tailored care. Why early testing changes everything. Our 22-year-old's turning point was timing. Early HIV testing revealed the missing link, so we could start antiretroviral therapy, calm systemic inflammation, and build an actual prostatitis plan. Anti-inflammatories as needed. Pelvic floor relaxation instead of constant Kegels, an alpha blocker to ease flow, short antibiotics only when cultures proved bacteria, sleep, and stress control. Within weeks, his pain curve finally bent downward because we stopped guessing. Your 60-second action plan. Schedule an HIV test today. Add an RNA test if the exposure was recent. If prostatitis symptoms persist beyond 6 weeks, book urology and ask for targeted diagnostics. If negative but at risk, discuss PrEP. If exposure was within 72 hours, ask about PEP now. Start immune supportive basics tonight. Hydration, consistent sleep, movement, and cutting nicotine and excess alcohol, none replace treatment, but all improve recovery. Say this out loud. I choose clarity over fear. Then do what our 22-year-old did. Act today, not someday. The sooner you name the cause, the sooner you heal, and the fewer months you lose to pain and pills. Clarity saves time, pain, and money. Testing today changes your trajectory. Before we wrap, I want to speak to the part of you that knows waiting hasn't worked. Our 22-year-old didn't get better by guessing, he got better by acting. If this video helped you connect even one dot, don't let that clarity fade. Subscribe to follow the full HIV education series. New episodes each week on testing, immune health, prostatitis recovery, and real patient stories. Turn on the bell so you never miss the next step. Your questions drive this series. Drop a comment with what you need me to cover next. Testing windows, CD4 counts, prostatitis versus CPPS versus STIs, PEP and PrEP, medication side effects, or the tough conversations about dating and disclosure. I read the comments daily, and I'll answer the top questions in upcoming episodes and pinned replies. For faster answers, start your comment with question and add your age range, 18 to 24, 25 to 34, 35 to 44, plus your main symptom. If you prefer privacy, write private, and I'll address it without personal details. Your voice shapes this channel, and your courage could save someone who's silently struggling beside you. Share hope. Knowledge travels faster than fear. If this helped, say READY in the comments, or use our private code. 1. Helpful. 0. Needs improvement. And if someone you care about keeps battling mystery pelvic pain, share this video with them right now. You might be the reason they finally get answers. Here's your next move. Book your test, schedule the right clinic visit, and then hit subscribe so we can walk the roadmap together. The sooner you act, the sooner you heal. I'm Dr. Jame. Thank you for trusting me with your time and your health. I'll be here tomorrow with another step forward. Subscribe to follow the HIV Education series. Comment your questions for Dr. Jame to answer.